Thank you for joining us today. Hello and welcome to From Lansing with Love. I'm your host, State Representative Leslie Love. Every month we discuss a different topic with interesting guests. I hope you will find this program both informative and insightful. Michigan voters approved the use of marijuana for medical use in 2008, but the regulatory structure has been hazy at best since voter approval. Medical marijuana is a serious concern for people in and around Detroit, since officials say there may be as many as 290 marijuana dispensaries in the city. That's more than one per square mile. There are about 12,000 registered medical marijuana patients in Wayne County and nearly 19,000 in bordering Oakland and Macomb counties, making Detroit an attractive market. Last year, Detroit made significant steps to regulate medical marijuana and its business practice with stricter licensing and zoning practices for dispensaries. Detroit's Corporation Council said they have closed down more than 160 dispensaries that were operating illegally under the new ordinance. In a step towards statewide regulation, last September the legislature passed and the governor signed a package of bills collectively known as the Medical Marijuana Facilities Licensing Act and Marijuana Tracking Act that created the Bureau of Medical Marijuana Regulation. Next year, Michigan will begin issuing 5 types of licenses for businesses associated with medical marijuana, from dispensaries to transporters. The license for dispensaries is causing some concern and confusion. Dispensaries can begin applying for a license under the new rules on December 15th of this year. However, the issue has been raised over whether dispensaries will be closed after December 15th until they get their license, and those who remain open will jeopardize their chance for a lucrative state license. In the rush to legalize marijuana for any use, the harmful effects may be ignored. We have with us today the director of the newly formed Bureau of Medical Marijuana Regulation, Andrew Brisbo. The Bureau was created in 2017 to implement the new law and oversee Michigan's existing medical marijuana registration card program. The Bureau's mission is to establish Michigan as the national model for a regulatory program that stimulates business growth while preserving safe patient access to medical marijuana. Mr. Brisbo has been in licensing and regulation with the state of Michigan since 2004, including experience with Michigan Gaming Control Board, Department of State, and Occupational and Health Professional Licensing in the Department of Licensing and Regulatory Affairs. That's a mouthful. So thank you for being here and welcome, Mr. Brisbo. How are you?
I'm doing very well. It's a pleasure to be here with you.
I am so glad that you are. So now that the new laws are in place and we're getting ready to accept applications on the 15th of December, can you tell us how you think you're going to function once this starts to be enacted?
Well, we're working diligently in order to set up the infrastructure that's necessary for this program to be successful. So that involves a lot of IT preparations. We have to set up 2 different IT systems, one that will allow us to track licensees and allow them to apply for licenses, and another under the Marijuana Tracking Act that is called the statewide monitoring system that's required for all licensees to use to track all their inventory and sales and the transportation and testing. So that's been a big lift to get done since last September, but we're on pace to have that ready to go. We also have to work on emergency rules so that we can lay out the basic elements that will be necessary for this program to start effectively. But we're on schedule with that as well, so we fully anticipate we'll be ready to go by December 15th.
So how does one know how to apply for an application?
Sure. So we've been trying to put information out in terms of what the requirements are going to be and what the process is going to look like. In terms of exactly what applicants are going to need to do, we're going to do a road show in November where we're going to go to locations all throughout the state and actually do physical demonstrations, both of the application process and how that system works, as well as the statewide monitoring system, so licensees can get a look at what they'll have to use day to day to manage their inventory. We also intend either in October or November to release a checklist so that applicants can start preparing the types of documentation and information they'll have to provide to us in December.
Well, that's good. Will there be a website available for, if I had a dispensary, I want to know how to proceed with this, I want to be one of those dispensaries that receives a license and be in compliance, you know.
Yeah, they can go to our website. Our website is michigan.gov/medical marijuana. And if you go to that site, you can also sign up for our email distribution list. We try and get information out via email frequently.
That's good. So there's been conversation about this December 15th date. And what is the deadline day? Like if you are operating a dispensary right now, you should stop until we receive the applications, process it, and then send you out a letter that says you are officially a licensed operator in the state of Michigan. Is that December 15th when they stop that?
Our intention now is that any facility that continues operation after the application process begins may face an impediment to licensure if they continue operation. We want to make sure that we start with a clean slate entering into this new program, and that all prospective licensees have the same opportunity to obtain licensure.
Okay, so I want to be clear for the people watching, because this is definitely a hot topic in the city of Detroit. If you start taking applications on December 15th, and you're processing. So I imagine processing will take a period of time. Do you know what period of time that would be?
We're hoping that we'll be able to issue licenses in late March or early April of 2018. There is a thorough background check process that has to be undertaken to ensure that licensees meet the qualifications.
Okay. So December 15th, that's when people who are operating dispensaries should stop doing that.
Correct.
Okay. And if we don't, or they don't. I don't have a dispensary, but if a dispensary did not stop, is it that the state comes in, the local officials? Who would regulate this period of time where we're in suspension?
Sure. So as a regulatory agency, the only impact for us would be that we would potentially consider that as a barrier to licensure for the applicant. We don't have authority to go out and regulate existing facilities now. We're not a law enforcement agency, but they could potentially face the risk, as they do now, of law enforcement coming in and taking action.
Is there anything the Bureau will do to provide support for local law enforcement? Or is there any effort to coordinate what you're doing with what locals are doing to try to make sure everyone's following the law?
Yeah, it's important for us to establish good partnerships with a number of different agencies in the implementation of this program, and law enforcement is a critical component of that. The Michigan State Police has been a good partner for us in assisting directly, as well as helping us to reach out to local law enforcement agencies.
What is the Bureau doing to increase outreach to the community about what's happening? Because I think there'll be a lot of conversation. Can we operate? Can we not operate? And how would patients respond to this? I'm a patient, and my dispensary may have applied, and we're waiting to hear back. What will a patient do in the meantime?
Well, that's one of the reasons we wanted to get this information out in September, was to give ample time for patients to find resources in order to ensure the continuity of their care. So the patient caregiver model still exists. That's unchanged from the 2008 law. So a patient that currently uses a dispensary for their needs has several months in which they can find a caregiver who can help them get the medicine that they need.
Okay. So once the license has been issued, what role will the Bureau play in enforcing the rules and making sure that dispensaries are honoring the terms of the license?
So we will be doing, we'll have a good field presence. We will do inspections. We will do investigations based on complaints and based on routine matters. And so we will have a very good presence in the field. And we want to be in these facilities monitoring what they're doing and ensuring that they comply with the law. And a lot of that investigation will be in coordination with the Michigan State Police as well, who will handle any criminal violations and investigations, whereas our agency will handle administrative violations.
So this is big. This is huge. When this conversation first began, I came into the legislature. I remember voting and talking about this. And in my district in particular, because I have the largest part of the 8-mile corridor of any of the Detroit delegation reps, and it's the border. It's a bordering boulevard. And so we have quite a few marijuana dispensaries. And time again, I've had residents come to express their displeasure with the overproliferation of those dispensaries. In the same token, I've had dispensaries and patients say, hey, I need access to my medicine. This is a business. That's the next gold rush. How will this medical marijuana licensing board function in this environment, different from the Bureau of Regulation? What's the board's function? Who's on this board that gets to pick who gets to get these contracts? And I know there's a lot of questions. And then, is there a limit? is this an unlimited amount? Are local municipalities able to say we're only going to have 10 in our area?
So the board consists of 5 members who are all appointed by the governor, and they're in place now. We've had a few meetings, and we're getting them up to speed, and they'll be prepared when those applications start coming in. One of the board's primary functions, as you said, is to make that determination, that final determination on whether a license gets issued or not. So that is a big part of what they do, and they also consult with the department in terms of promulgating the administrative rules that add a lot of clarity to how these facilities can operate and how the program unfolds. So the state law doesn't allow us to place the limitation on the number of licenses issued, but municipalities do have control for what they'll allow in their municipality by ordinance. So they can restrict the types of facilities. They don't have to allow all 5, and they can also place a cap on the number of each license type that is permitted to operate within that municipality.
And tell us, what are those different license types?
So there's a grower, which is split into 3 categories, class A, B, and C, A being the smallest, C being the largest, processors, provisioning centers, commonly referred to as dispensaries, secure transporters, and safety compliance facilities, which are the testing labs.
Wow, it's a brand new industry that we're creating. And a lot of the conversation locally would be about dispensaries, but there are other areas of this to look at, and it's an entrepreneur's opportunity, whether you want to be a transporter or a processor, the testing lab. I don't know if this is your area of expertise, but I want to ask you, I know I have another guest coming on, and I'm going to ask this too, but do you think that there'll be a rush of people trying to figure out how to get into those other areas of the business? And is there any training required, or what kind of expertise do you think they'll be looking for?
So we're working on defining some of that, exactly what the qualifications will be for all these different license types. The safety compliance facilities, for example, they have to have someone on staff that has an advanced degree in certain sciences that can run that operation. Processors and growers have to have on staff someone with at least 2 years of experience as a caregiver. So they want the statute contemplates having someone that's been operating in this capacity to some degree in Michigan, working in that facility. But we expect there to be probably a tremendous rush at the beginning of individuals that are interested in getting in. The qualifications are important, and that's why we want to get that information out as to exactly what is necessary to qualify. The statute lays out some certain criminal convictions you can't have, but more will be forthcoming in the rules. And even beyond the license types, there are other tangential industries that will likely evolve to support this industry as well.
Like what?
Well, there are several companies out there already now that you can think of the normal things, marketing and advertising and so forth, which will be restricted in this industry, maybe more so than some others. But there are services now that offer location services for various facilities. It's interesting because it is growing, and it's new to this state. It's new nationally, frankly. So I'm not sure anybody really knows where exactly this is going to go.
I can imagine there'll be even realtors who find a niche of, I can tell you where you can locate these places that are friendly to that industry. So is there anything else you can tell our viewers whether you are a patient or a person who does not like that this is coming online, anything else of how you would interact with community or in this process at all?
Sure. Well, we're trying to have a strong presence in the communities. We want them to understand what the state's perspective is, and we want to communicate with the municipalities so that they're prepared for this rollout as well, and they can adopt their ordinances from an informed perspective in such a way that aligns with the state statute and what our intention is in terms of the administrative rules. So that way there's continuity for patients and for caregivers. The businesses understand what the requirements are and can operate effectively. We want this program to be successful. Our agency is focused on allowing businesses to grow and ensuring safe patient access to medical marijuana.
Thank you. That sounds good. So the Bureau will be functioning in a way to make sure that you're taking in those applications, you are having legitimate operators that are taking care of their patients, and people have access to those safe things, as well as respecting the wishes of those local communities and working in collaboration with local law enforcement and the state police to enforce these laws and oversee that. But the Bureau itself is not coming to close down anyone.
That's
not your function.
We do not have that authority.
All right. Well, thank you so much. It is time for us now to take a short break, and we'll be right back after this. welcome back to From Lansing with Love. I'm here now with my guest, Mark Reene, the prosecuting attorney for Tuscola County in Michigan's Thumb area. Mr. Reene began his law career in Wayne County, but he has worked in the prosecutor's office in Tuscola County since 1993 before being elected to prosecuting attorney for the first of his 5 terms. He is a member of the Prosecuting Attorneys Association of Michigan Board of Directors and a frequent lecturer at a variety of prosecutor trainings. Thank you again for being here. I'm excited to talk to you because I know you have lots to say on this topic. But before I get into the questions with you.
Thank you for having me.
Well, I'm glad. Yes, welcome. Let me tell you, Mark, can I call you Mark?
Please.
Yesterday, I went to fill up my car with gas, and as I'm going in to pay for the gas, on the counter there's lots of things, toys, those little fidget things, and some quick gum and mints and candy, and then I had this. So it looks like, I don't know if the camera can zoom in, we'll probably have a picture later on in the show, but this looks like what marijuana, medicinal marijuana, comes in a tube like this, but this is not marijuana. No, it's called chronic candy. It's chocolate that looks like marijuana. It sells for $20. At least it was sold to me for $20, no tax. And it's the OG Kush flavored, and it comes in banana, strawberry, chocolate, vanilla, and other. And it bothered me to see this because this is the type of, and it says it has some particles of marijuana in it. The seller really wasn't very clear. It's like, well, what parts? It's got the CBD. What's that? And so, but it's for sale for me. I don't have a card. I'm not a medical marijuana user or marijuana user, but it's attractive. So what is this? What is this saying when we're introducing? We've opened up medical marijuana. There's ballot initiatives to make marijuana just legal in general. How is this going to play out? Is this a good thing or a bad thing?
It's a terrible thing. And what you experienced yesterday when you went into a store, what was available to you would have been available to a teenager for purchase in the exact same manner. That's a concern that we have, and that's why the Prosecuting Attorneys Association of Michigan has come out strongly at this point in time in regard to any further proliferation of marijuana. We have to take a look at what's happened with medical marijuana and what's happened in other states with medical marijuana and the legalization of recreational use. In 2008, when Michigan passed the initiative for medical marijuana, obviously there was a strong sales pitch in regard to what was necessary for patients that were suffering, patients that were in end-of-life circumstances. And no one disagrees with having that opportunity and something provided to aid someone in that setting. But when you look at now, who we have by way of medical marijuana cardholders, and we need to do that. We have 218,000 medical marijuana cardholders in the state of Michigan. We are second in the country to the state of California. And last time I checked, the state of California is a bit larger than us. When you look at who has the cards, and we have those demographics, it breaks down to about 4.5% are cancer patients and 93% are chronic pain and other severe pain, which obviously can be very difficult to diagnose. The 18 to 35-year-olds in that demographic, let's say, are a bit overrepresented across the age spectrum for who has cards. So is what was intended actually become the reality in this state? And the answer to that is probably no.
So in November, the State Auditor General's office found widespread fraud in insurance of in issuing medical marijuana cards. In fact, one doctor alone certified over 11,000 medical marijuana applications in 2015. Is this a problem that law enforcement needs to go after? I don't want to just, we shouldn't just focus on the patient, but the doctors who are just giving out these cards. Is this an issue?
Absolutely.
How do we address it?
And that's been done, and we gather data, and there have been a lot of investigations. There was actually a joint investigation that encompassed my county, Tuscola County, went into Sanilac County, St. Clair County a number of years back, involving a dispensary. Dispensaries are still not lawful under the present statute, so that's why action was taken, and that's what has to occur.
Yeah. Let me go back to an answer that you just gave about the demographics here. a large portion of the people who have these cards are between the ages of 18 and 35. This is that good working age that you have in your life. And as the Democratic chairperson of our Workforce and Talent Development, we hear over and over again that we're looking for people in our professional trades careers. And these are people anywhere from folks working on the new arena project to building the next skyscraper in anyone's downtown, to working on the roads. And you're often with heavy equipment or just other people's lives in your presence. And marijuana is a disqualifying factor over and over again. And I've noticed in talking to young people and this idea of, hey, it's better than alcohol. Look at all the people who are using these other drugs. And it feels like they're being discriminated against because marijuana is this good for you drug. Are we romanticizing marijuana?
Very much so, and the data also supports that perception, because and you've addressed a very important issue to the workplace, and where we're at in our state right now, we've finally begun to turn the corner, and we're seeing that both in our urban areas as well as our rural areas economically. So this is a crucial time. But when you look at data that's coming out of other states and states that again have expanded use of medical marijuana and recreational use of marijuana, those stats come back with 85% more industrial accidents by individuals that use marijuana. They come back with 55% more injuries by those that use marijuana. And they come back with 75% more absenteeism. There are employers that are begging for individuals to come in, and they're not looking for star performers. They're looking for individuals that can simply do a job and do it well and do it safely, and are having a hard time finding those people. That's not a position we want to be in economically in the state of Michigan.
All right, but are we beating up on marijuana users? Because it's really interesting. It's like, it's cigarette smokers, and they're alcoholics, and we have programs for those folks. But it seems like, are we beating up on marijuana smokers or users?
Don't think so. I think again, there's a like all things, there's moderation and there's abuse, and unfortunately, many times what we're experiencing and what we're observing, certainly through law enforcement, public safety, healthcare, is that what happens with marijuana use is that it then reaches that level of abuse. And one important thing to note is people that use marijuana, about 9% of the individuals across the board become addicted. But with teenage use, about 17% become addicted. So that becomes a lifelong addiction, which impacts your ability to
But they say marijuana's not addictive.
And that's incorrect. And all the data and all the medical data proves that to be incorrect time and time again. And what happens though, and this is one of the things with our young people, there's a great study out of New Zealand that talks about people that start using marijuana in their teenage years. They actually lose IQ points between the ages of 13 and 38, about 8 IQ points. And those points you don't get back. And that lost mental capacity, you're not able to regain.
But are we, again, I'm just wondering, is there a middle ground? Is there a safe place to look at this? Or is it not your granddad's marijuana? I was at a conference and I look at this and go, I don't want people to medicate here. I really wish you would go and get the proper care that you need and seek a professional. But it's available and it's there. So.
Great point. Mm-hmm. The not your granddad's or your Woodstock's marijuana. The THC level was entirely different then. The levels are so elevated that people don't often have an appreciation for what they're consuming or the impact that it's going to have upon them. And now you have all the forms of marijuana, like you're pointing to here, that you got off a store shelf. If you walk into stores in Denver, this is what you're confronted with now. And there are all the comments about how things have gone so horribly wrong. But you have the marijuana in the form of edibles, gummy bears, and you'll be told that, well, the proper dosage for a gummy bear would be to eat the head of a gummy bear. Well, children routinely end up obviously accessing those types of foods, and then you have serious overdose situations.
Well, I'm gonna stick to adults for a moment, because edibles is huge too. And I'm thinking, it's one thing when you create it to smoke it. And even in my trips to the dispensary for educational purposes, to learn, and I'm meeting with those provision center owners about how they handle the marijuana, and the different types and the strands. And some of them are very responsible, very knowledgeable. And then there are also some who, this is a guessing science. And then when you start to cook it, it changes the chemistry balance altogether. Can we really, I mean, I just spoke to the director in the last segment. Can we really accurately create medicine from this? Do you think we have the systems in place? Are we ready to go online and look at this as a legitimate option for medicine?
Not yet, and there have to be more studies to get to that point, and that's the problem. Marijuana is a Schedule I drug, and of course the issue that remains lurking for all of us is the fact that it's still illegal under federal law to use and possess marijuana, and still it's scheduled at the level of 1 for the reasons you're articulating right now. They're unable to establish safe medical use. They're unable to determine the proper level of THC in dosage, monitor dosage, all those circumstances. So somebody being just left to self-medicate often leads to obviously challenging circumstances in their life, but oftentimes horrific consequences.
Like I said, there's this romanticized vision of marijuana. What is bad about it? What's so harmful about marijuana that if you want to smoke it recreationally, or if you want the medicinal version of that, you're free to have it. Let it be.
That may be my favorite question to this point in time. We luckily have the opportunity to look at what's happened in other states, and we have the chance to look at what's happened in California and Colorado when, after having the advancement of medical marijuana and recreational use of marijuana, their traffic fatalities, they experienced a 100% increase in marijuana-related traffic fatalities. In the state of Washington, in the first year after providing for retail sales of marijuana, their traffic fatalities related to marijuana went up 50%. 1 in 5 traffic fatalities in the state of Colorado presently is related to marijuana, and that number is increasing. For the first time, and I know you're aware, Representative, last year in the state of Michigan, we had over 1,000 traffic fatalities in this state for the first time in over a decade. That trend is continuing this year, and this is another component and another thing to make us think, why is Michigan going to be different?
There's an industry here. It's the next industry. Last industry was the tech boom. Now we have marijuana in Michigan. There's an opportunity to create millionaires, some people would argue. Marijuana has existed before we legalized it. Now we've legalized it. We have these systems in place. We'll have transporters, testers, processors, provision, and then the user. And all of that creates millions and millions of dollars for the state of Michigan. Why crush that?
Again, you have a chance to take a look at the state of Colorado, and that similar industry, so to speak, such as it is, the tax revenue that comes from that industry is slightly over 1% of their total tax revenue for the state. And when you look at all the other costs that are associated here, loss of life with traffic crashes, the economic impact on children, health, it vastly is outweighed.
Okay. Well, with that, that's about all the time we have for today. What an amazing topic we've discussed, and we've just barely touched on it this day. And I'm looking forward to some more conversations with my viewers and guests on the show to further discuss marijuana in Michigan. So I'd like to once again thank my guest, Andrew Brisbo, the director of newly formed Bureau of Medical Marijuana Regulation, and Tuscola County Prosecuting Attorney, Mark Reene, for joining us. And thanks to all of you for watching. If you have an idea for a show or would like to be a show guest, please contact my office, and that contact information will be on the screen. But before I go, just so you know, I'm going to try this, and I'm going to come back and tell you what was the effects, if any, of this chronic candy, OG Kush. So until next time, we're good. Be good to yourself and each other. And with that, we're all clear and out of here.